For years, Texas has ranked among the worst states in the country when it comes to maternal mortality. For black women, the numbers are even worse. The CDC says black women die from pregnancy-related issues at 3 times the rate of white women. Closing that gap and improving those numbers is part of Black Maternal Health Week, and that is a priority at Parkland in Dallas. Joining us now is Marjorie Quince-Buzid. She is the Senior Vice President for Women and Infant Specialty Health at Parkland. Ms. Quince-Buzid, thank you for being here. Let's talk first about these startling numbers because maternal mortality is especially concerning in Texas. Why is Texas so poor when it comes to this?
Well, thank you for having me. And the reason why we're talking about this is bringing awareness to this issue. There are a number of reasons why any state in the United States have a widening gap of disparity for Black maternal health. What we're finding is it is very complex and complicated. Typically, women have pre-existing conditions, and then we enter into a system that is not necessarily astutely aware of these conditions and cause their conditions to worsen by not listening to them, taking their complaints seriously, and not treating them with dignity and respect during the birthing process.
There at Parkland, what are the leading causes of death that you guys are seeing with black mothers especially?
So we look at all of the deaths in the state of Texas. In order to come up with a rate, we look at about deaths per 10,000 births. So we look at all over Dallas, as well as the state of Texas. And we're finding women with cardiovascular related disorders. Interestingly, we've seen an uptick in the last 4 years in maternal deaths related to substance use and behavioral health conditions and violence of some kind, either homicide or suicide. Those are the top leading causes of preventable maternal deaths in the state of Texas.
And when you talk about some of those other issues there, besides suicide, et cetera, are these health issues not getting caught in prenatal for many of these mothers?
For those who have, we pride ourselves there at Parkland that most of our moms have prenatal care. So there's an interesting death occur either during the pregnancy. The state, when they reviewed all of their deaths between for a 4-year period, realized that women were dying of pregnancy-related deaths up to a year post-delivery. And those women are not necessarily in a system of care because their pregnancy is ended.
Right. So what can mothers do then if they are, if they're seeing this and, a year after giving birth too, that's something that people need to really pay attention to.
Yeah, absolutely. The pregnancy-related death is a death that would not have occurred had the mom not have a pregnancy. And so what moms should be paying attention to is talking to their providers, knowing the signs and symptoms. If they have a high blood pressure, other cardiovascular disease, making sure that they're stay connected with their providers. One of the things that we found as a barrier for women is access to care after they've delivered. The state did recently increase Medicaid coverage up to 6 months. A lot of women need to be aware of that. So if you've delivered and you need to go in because you're having shortness of breath, you can't breathe, there's swelling in your legs, please call your provider and go in to get seen. Know the signs, early warning signs, and advocate for yourself. Encourage your, recruit family members to help advocate for you.
Yeah, it's just a matter of making sure you stay in touch with your doctor and know the signs as you're talking about there too. Marjorie Quince-Buzid, we appreciate the insight, and hopefully that message is getting to some mothers out there in Dallas-Fort Worth. Thank you for the time.
Thank you. I appreciate it.